Welcome, everyone. I'm Dr. Liana Lianov, and this is the Lifestyle Medicine series for the RCSI, University of Medicine and Health Sciences. And today's topic is an introduction to lifestyle medicine and what lifestyle medicine is about. And I'm delighted to have as our guest, Dr. John Bonnet. He's board certified in family medicine, sports medicine, obesity medicine. He's a clinical associate professor affiliated with the Palo Alto VA medical center in California, and many more things. A longtime colleague in lifestyle medicine. So welcome.
Thanks for having me, Liana. Excited to be here.
Uh, it's lovely to have this brief chat with you about one of our favorite topics. We're longtime big advocates of lifestyle medicine. So tell us the basic role of lifestyle in disease. We know they have a lot to do with each other, but tell us more.
Yes, I think this dates back to many of the early days of medicine, even back to Hippocrates, who recognized that our diet and certainly physical activity were probably some of the most important things related to good health and well-being. And so I think we've sort of known this as a society that for a very long time. And more recently, much of the research and data has come out that really does support that. And so there are different estimates that are out there, but I think probably a fair ballpark is about 80% of the chronic diseases that we typically see here are related to modifiable lifestyle behaviors. And probably some of the major ones that contribute are unhealthy diets, physical inactivity, smoking and alcohol intake, and then probably weight as well. So these were the primary things that have really driven a lot of the increase in chronic disease that we see. And this is everything from heart disease to cancers to diabetes, and pretty much everything else in between that you can think of. So they have a really, really prominent and important role in much of the chronic disease epidemic that we face.
Yeah, it's that underlying root cause, we like to call it, that connects so much of what we're struggling with in our modern day diseases that we're facing. And we're learning a lot from over time from all kinds of scientific studies, as well as more observational studies. And one of those has to do with these blue zones, which some of the folks may be familiar with, and we'll be actually talking about blue zones and nutrition a little bit later in the series. So tell us more about what lessons we've learned from those blue zones.
Yeah, the blue zones were actually coined by a Belgian researcher, Michel Plein. And this was actually decades ago. And he sort of was an epidemiologist that studied populations and was interested in these pockets where people tended to live to at least 100 years or more. So we call those people centenarians. And he identified 4 locations around the world that seemed to have a high proportion of these individuals. And so the initial ones that he identified were Sardinia in Italy, Ikaria in Greece, Okinawa, Japan, and the Nicoya Peninsula in Costa Rica. And those were sort of the original 4. And then since then, others such as Dan Buettner from the National Geographic, they also have included Loma Linda, California as one of them. And then more recently, Dr. Pulaine identified the island of Martinique as another up-and-coming blue zone. But the idea here behind these is that there seemed to be something special about these places, and they weren't sure exactly what it was. I think there's lots of ideas and thoughts. This is obviously epidemiology, so it's hard to do a randomized controlled trial here to figure out what exactly the secret to their longevity is. But they sort of spent a lot of time studying them and tried to understand what are the things that these people do that seem to give them a benefit and help them live, to be much longer, and not just living longer, but living much healthier. So people in their ninth and 10th decades of life were still being very active and very much a part of the community. And so the things that they have sort of distilled down as what some of these commonalities may be, I think sort of the 4 broad categories are movement, eating wisely, having a good outlook, and then also connection with one another. And then more specifically within each one of those, the idea behind movement is sort of moving naturally within your environment, being active throughout the day, walking around, picking things up, gardening, carrying things, sort of the normal day-to-day life that oftentimes in modern societies, we don't do as much of anymore. So that's one component, is the physical activity piece. From a diet perspective, people have focused a lot of attention on this. And again, I think their rules are probably a bit more general than many people like to think of in terms of our rigid dietary dogma that most of us kind of follow. But in general, they tried to say, hey, stop eating when you're about 80% full. So not eating so you're overindulging in things. Have sort of a plant slant. So not necessarily a completely animal-free diet, but also a much more emphasis on whole plant foods. And then sort of small amounts of animal products, sort of depending on the culture and preferences of the individuals. And then they often tended to consume wine. Again, it was often done in moderation. So this was not a, hey, it's good to go out and drink, 6 glasses of wine, but there seemed to be some potential benefit, and we're not sure if it's from the social benefit or what exactly it is, but this seemed to be a common trend of sort of being able to just relax and enjoy a glass of wine. Now, the other things going beyond nutrition and sort of movement that they identified were things like having a better outlook in life. And so this comes down to like having a clear purpose, sense of meaning, and also time where you can sort of downshift and de-stress. So having ways to sort of cope, manage, deal with the struggles of life, but also having a reason to get up every day, something that you're working on, working towards, seems to be really important, particularly as we age. And our sort of preferences and priorities can change, but still having sort of that meaningful pull to engage in life. And then the last part really was connection. And I think these last couple are kind of where the magic occurs in these places, because it's finding a tribe of people that you can sort of align with, that you get along with, that you're friends with, you can laugh, enjoy time, and really prioritizing family. And then also even having friends just beyond your family. So a real strong sense of belonging in these kinds of communities. So again, it's tough to say that there's not one magical thing that they do, but I think they've built environments where all of these things are basically baked into normal life. So you move naturally, you eat well, without a focus on all this ultra processed, less healthy food. You have opportunities to sort of connect and engage with the community, but you also have a strong sort of purpose and ability to sort of deal with any stressors or things that may come up. So I think the Blue Zones have sort of helped us identify, what healthy living can look like throughout the lifespan. So I think that's one of the cool contributions that they've been able to make to us.
Yeah, these are wonderful lessons that so many healthy populations have been living through the eons, and we've just managed to put it all together in our modern society and modern medicine. Like, yes, there's something really to this, and so that has over the years led to physicians and other healthcare practitioners saying, well, we got to offer this to our patients. This is the way to offer really effective, powerful medicine, even though it doesn't come in a pill and comes in all the ways that you've just described. And that has led to the birth of this field of lifestyle medicine. So tell us a little more about how we're defining lifestyle medicine and what sort of the principles and the background is around this field.
Yeah, so I think the official organization of the American College of Lifestyle Medicine came to fruition back in 2004, and you're actually one of the past presidents of this society. So you are definitely one of the gurus here. But anyway, I think the whole idea is basically creating a medical specialty that really focuses on this as the primary modality to treat, reverse, and also prevent chronic disease. So not making it a secondary or tertiary aim, but really the primary thing that we use. And then once it's exhausted, then again, you can certainly use medications or surgery when it's appropriate. But really, lifestyle medicine focuses typically on 6 pillars, although depending on who you're reading and what organization you follow, there could be more or less pillars. I think the number is less important than the concepts. And so to make it easy to remember, I've stolen David Katz's. It's what you do with your feet, your fork, and your fingers. So the 3 Fs. So feet is activity, movement. Fork is what you put in your mouth, your diet. Fingers is sort of substance use. So hopefully not smoking or working to cut back on that. And then, either moderate or no alcohol consumption. And then the other 3 to round out the 6 are sleep, stress, and love. So getting good, adequate, restorative sleep, having ways to cope, manage, and deal with your stress, and then having loving, meaningful relationships with yourself, the people around you, and a higher power if you so desire. So I think not only is there good data, again, to support sort of the notion that this is really good for your health and combating chronic disease, helping prevent premature mortality, but I think more importantly, they're some of the best ways to just improve the quality of your life. And so I think that's where lifestyle medicine's true magic is, not just in the disease prevention, but actually in the health promotion and creating a sense of well-being in people.
Yeah, absolutely. And so then our listeners are saying, probably saying, I hope they're saying that this sounds great. I want this for myself. So then the natural next question is, well, where do I find more information? What are some credible evidence-based, science-based resources where I can learn more? And unfortunately, I wish we had more lifestyle medicine practitioners for people to access, but maybe they can learn about it and bring it to their healthcare team. And we want more converts towards lifestyle medicine. But tell us more about credible resources.
Yeah, I mean, the good news is it is a growing field. I think there's more acknowledgement, recognition, and I think there's just more of a desire from patients and even providers alike of knowing that our current health system really isn't probably optimal. It's very expensive, deals with lots of medications and procedures, and frankly, we probably don't get the health outcomes that we all would want. So hopefully there are more clinicians who are providing these types of services, but I think also just patient demand will sort of create providers soaring, getting educated. I mean, obviously the RCSI is a wonderful resource here that people have obviously found, which I think is a great place to start. Certainly we have databases where people can look and search up for lifestyle medicine providers. I know we have that in the States. I don't know if the exact same analogous exists in Ireland, but I'm sure there are similar organizations where you can identify board certified physicians. So the American Board of Lifestyle Medicine would allow you to search, and it is international and worldwide. So we have physicians all over the world in many, many countries. I don't know the exact number off the top of my head, who are certified. So that would be one clear way to find a provider who is sort of clearly well educated and well versed in this topic. I think there are many good books. So the American College of Lifestyle Medicine has lots of good resources available. Dr. Frades and I, who's the current president of Lifestyle Medicine, we have a Lifestyle Medicine Handbook, The Power of Healthy Habits. And there are many other good resources and books that have been published. I think looking into some of the blue zones, there are websites that have sort of conceptually these ideas and frameworks that people can use. And there are a number of podcasts. I don't necessarily want to call out any of them specifically, but there are many that at least have this kind of information. And so hopefully, you know, if someone is certified in lifestyle medicine, you're probably going to get a pretty reliable source of information from them. But I think those are probably the things that I would start with, and then just asking around in your communities. Because I think, again, one of the big things of lifestyle medicine is not just finding a provider to work with you, but then also figuring out ways that you can engage the community as well. Because I think that's a really way to make sustainable changes when it becomes the normal default environment that we live, work, and play in. So I think anything that you can do that sort of creates that sense, and then also just starting with yourself. So again, basic stuff that I think most of us probably have been told at some point, but it's just difficult to translate. So just thinking about your own diet. I mean, many of us understand what foods are healthy or less healthy. Most of us recognize that movement is important. Our sleep is valuable. And so figuring out, you know, from ourselves, where do we sort of stand and stack up? I have a lifestyle medicine assessment I'm happy to share with people. They can go online, get a score, and get a sort of a sense for how they're doing in each of the pillars, and then sort of use that information then to say, okay, well, you know, I scored really well in, you know, movement, but maybe I didn't score as well in recovery. So maybe I need to focus more on my sleep hygiene or, you know, my stress management skills. So those can be some places to start, and then just continuing to ask questions, explore, and then reach out and connect.
Very well said, John. I love the way you framed it. And we do need to start with ourselves, as they say, put on our own oxygen mask, be role models for our family, friends, and have those ripple effects in our community so that it becomes the norm in our communities, as well as that then when we do seek a health provider, they're in tune with all of this approach of a healthy lifestyle as being the primary way to not only prevent disease, but if we are so unfortunate to have a disease, that this is the primary way to treat it first and foremost before we go to pills and procedures, etc., because there are fewer side effects, and also because it just works so much better. And so that's why those of us who are passionate about this are promoting this message around the world. So thank you for joining us. Any last take-home message you have, key take-home for our listeners around this?
I mean, I guess I'll throw one other resource out there that I just came to my head. Full Plate
Sure.
Living has a really nice online sort of diet track you can work through. That's really good. It's free and available to anyone on the internet. So that's another good resource. But no, I think the fact that you are all here listening or watching this podcast tells me that you are very interested and invested in your health. So I think figuring out sort of where you're at and what areas, you know, might be ripe for improvement, I think is a great place to start. But then, you know, I love what you said, Liana, about the ripple effect of hey, your family sees you making changes and then they may also get on board as well. So again, it can become one of those things that becomes a gift that you can give to others, in the long run too. So yeah, I think don't be shy and also don't worry about being perfect, right? None of us are perfect with all of the lifestyle habits. We're all a work in progress. So I think progress is definitely what you want to shoot for. I'm not worried so much about perfection because life happens, it's stressful, it's hard. There's lots going on. So I think giving yourself some grace, but then also recognizing that there's a lot of really wonderful health benefits you can derive that will improve the quality of your life so much that you will find it is absolutely worth it.
Yes, yes, absolutely. And I love the self-compassion piece. We do have to be self-compassionate because this is an ongoing life journey to stay healthy and happy. So thank you again for joining us, Dr. John Bonnet. And thank you to our listeners for joining us for this podcast series on lifestyle medicine. And we hope to see you on another one of these segments. Take care, everybody. Bye-bye.
We'll see you later.